Most people come to enjoy the fresh salt air at the Venice jetties, but lately,
we're all sitting around coughing. And people going, what's going on here? Why am I coughing?
many avoid the area.
It irritated the eyes and it kind of irritated your lungs.
Dr. Michael Petit, an ear, nose, throat, and sinus specialist, says that's common for anyone when red tide hits.
It's the toxin in the air, and you can smell the toxin in the air.
You can feel it in your throat and your head. And while red tide toxins are especially rough on people with asthma, lung cancer, emphysema, COPD, and other respiratory illnesses, Dr. Petit says he's treated many more people without underlying issues.
There's been an increase in the severity of the symptoms in people on a daily basis that are coming in with sinus, quote-unquote, sinus issues, postnasal drip, cough, eustachian tube dysfunction, sneezing, sniffling. It's continued, and it just doesn't stop.
This red tide bloom has been around for 10 months. It moved into Venice 2 months ago and brought with it a major headache.
People need to make sure that they protect themselves as much as they can from exposure to the toxin, because their airway issues are definitely there, even for people that don't have chronic problems.
Dr. Donald Ahrens, a pulmonary specialist, says his numbers have also increased.
We're seeing 5 to 7 patients a day. Some patients already have lung disease and other patients with no history of lung disease at all, but they're still having pulmonary symptoms.
Many are left wondering if there could be long-term effects. It's a question that's left unanswered.
We don't know how long-term exposure might affect these patients. There's no data to support.
In Venice, Kimberly Quizon, Fox 13 News.